Check your tongue now? White spots on your tongue can be a sign of COVID or a vaccine side effect, says expert. Before we start, please subscribe to my channel and click the bell icon, thanks. White spots on the tongue, it's usually nothing serious. But knowing the cause can help you determine the best form of treatment. Is it oral thrush, canker sores or leukoplakia? It could be a symptom of COVID, according to one expert. In most instances, if you spot a white patch on your tongue, it's most probably down to a case of oral thrush, Dr. Kailash Solanki, dentist for dental phobia, told Express Health. But particularly if you've recently contracted COVID or been vaccinated, he added. Dr. Solanki continued. Other triggers may include smoking, antibiotics, diabetes or anemia. Oral thrush occurs when your body's immune system is low and can be concerning as it sometimes involves a loss of taste, along with cracked lips and a dry mouth. It isn't usually serious and can be cleared up quite quickly by scraping the tongue when brushing your teeth. Another possible reason for white spots on your tongue might be canker sores, which are usually inflamed and more painful than oral thrush, said Dr. Solanki. Usually triggered by a virus or a low immune system, the sores are treated with either a special gel or a milk of magnesia solution. A much less common cause is leukoplakia, characterized by thick white or gray patches on the cheeks, gums and bottom of the mouth as well as on the tongue. Dr. Solanki explained. Sufferers tend to be tobacco users and drinkers, and it is thought that once contracted, the virus will lie dormant with occasional flare-ups throughout your life. A break from smoking and drinking will usually help to clear up the episode of leukoplakia. According to Amanda Shale, developer of Ya Self-Care by Puriskin, white spots can be classified in 3 ways. 1. Topography. Topography are taste buds, papillae that are swollen. This could mean a hormone imbalance, with pale or transparent meaning deficiency and red meaning heat, inflammation, said Shale. She added, or if the tongue, fur, has lengthened and possibly clumped together, this could mean an excess of some kind in that area. The fur looks like a flame, or if together this is combined with a stagnating condition which is considered a form of dampness leading to stagnation of the area or organ. 2. Coating. Is there an area of porridge-like coating but just in one particular part of the tongue? White spots, patches or large areas are always considered as a damp condition, and a Western view of damp is called candida, or thrush. Shale said. This can be the result of illness and antibiotic use. Fungus growth is also considered damp, which is a sign of a weakened immune system and failure of normal levels of healthy bacteria, e.g. in the gut. If in the upper part of the tongue, this could indicate bronchitis or other phlegm conditions. A large white porridge area in the back of the tongue could show dampness in the bowel and, if slightly yellow, constipation. A geographic tongue is areas that are white or slightly yellow fur and other areas where the tongue fur has peeled off. This would indicate more chronic conditions of heat and/or deficiency of the digestive system and probably other health problems as well. 3. Color. Is this white spot area really white? Or is it slightly yellow? White represents excess cold, yellow represents excess heat, said Shale. The state of your oral health says more about your wider health than you might think, said Sarah Ramage, clinical director, Bupa Dental Care. The relationship between the tongue and oral, general health is closely related. Dentists can often advise their patients about potential concerns before they've had the chance to raise them with their doctor. Ramage said white or red patches on the tongue can be signs of oral cancer. She explained, rates of mouth cancer have increased by nearly 60% in the last decade, so it's important to know what a healthy tongue looks like and be aware of any changes. A healthy tongue is pink in color with a slightly rough surface. Your dentist will look for signs of mouth cancer during your routine checkups. White, pale or red patches, or spots or lumps on the tongue could be a sign of oral cancer. If your dentist spots this, they'll ask you some questions about your symptoms and your medical history, and then if there are any concerns they will refer you to a GP or doctor specializing in mouth cancer. Ramage advised some people develop a white coating across the tongue as a result of a buildup of bacteria, food debris and dead cells. She added, it can also be yellow in color, caused by nicotine, tea or coffee stains. We all know that we should brush our teeth twice a day, but it is also important to brush your tongue every time you clean your teeth. The tongue harbors the majority of the bacteria in your mouth. It's important to keep your tongue healthy to prevent the bacteria transferring to your teeth and gums, causing damage and creating bad breath. Brush your teeth twice a day, floss, and don't forget to brush your tongue too. If a white patch in your mouth hasn't cleared up within 10 days, contact your dentist for an examination to rule out any other potential serious condition. Thanks for watching. Please share your thoughts in the comment. Thanks.